My name is Allison Braswell, and I'm a licensed clinical social worker, and I currently work with Methodist Healthcare's Dennis H. Jones Living Well Network. In 2008, I gave birth to my first son, Will, who will be 10 next month. And after I gave birth and after I came home, I began to experience symptoms of postpartum depression. It was a struggle to find the joy and the happiness that we're told that we're supposed to have when we have children. I've been a therapist for over 15 years, and I worked with women with postpartum depression as well as other mental health issues, and part of it was that I wasn't able to recognize that in myself. You don't want people to think that you're a bad mother or that you don't love your child. And so I didn't tell anyone in the beginning. I didn't even want to tell myself that this is how I was feeling. A few weeks passed, and I remember my parents came up to visit, and they knew immediately that something was wrong with me, that I was not my normal self. And so they encouraged me to call my physician, which I did, and was able to start treatment after that. I think the Living Well Network is important because a lot of patients and a lot of people don't know how to access behavioral health services in this community. Postpartum depression is a very real issue, and a lot of women struggle with it, and it's just important to get help, and that there's help out there, and don't ever be ashamed of how you're feeling. I think experiencing that personally just helped me become a better clinician. I'm passionate about it because there's such a need out there. There's a need, and there is a need for us to talk about it more. The unique thing about the Living Well Network is that we have relationships with behavioral health providers all around the Mid-South, psychiatry, therapist, inpatient, outpatient services. And so with those relationships that we have, we're better able to connect that patient to the appropriate service. I would say to other professionals who are experiencing their own mental health issues, do what we tell our patients to do. Seek out help.